Hi, my name is Terri Larkin. I'm a nurse practitioner here with Drs. Goodman and Partridge. A lot of the patients that we see here have issues with irregular periods, and that's what I was going to talk to you about today. A lot of times it's just something simple like they forgot to take their birth control pills for a couple of days, or maybe they're heading down that road to menopause. And then other times it's a little bit more complicated, like maybe they're having an issue with their thyroid, or they're developing diabetes or something like that. So when you come in for a workup for irregular cycles, you can expect to get a complete history taken, and we'll draw some labs, and then we'll do a pelvic ultrasound. Basically, the pelvic ultrasound is to take a look at the ovaries and make sure that they're functioning like they're supposed to be. And a lot of times what we'll find is that those patients have something called PCOS, which is polycystic ovarian syndrome. If you have polycystic ovarian syndrome, you're in huge company. 10% of the population has this. And a lot of times it's genetic. You'll find that an aunt or a grandmother had ovarian cysts, or they had trouble conceiving, and a lot of times they went undiagnosed, so they just didn't know what the issue was. Basically what PCOS is the ovaries are connected to the uterus, and inside the ovaries there's several follicles. Once a month, one of those follicles will get big, it drops down the tube to be fertilized, and you get pregnant. With PCOS, it's kind of like a slot machine. That doesn't always happen. And when it doesn't happen, the follicles stay in the ovary and they create cysts. And then those cysts create androgens. Androgens are the male sex hormone, so you end up with a little bit of hair growth up here, maybe a little weight around the middle. Other times you have issues with your cholesterol or how well you use your insulin. And the treatment for this is putting you on the birth control pill. Basically what the birth control pill does is harness the ovaries and makes them do the right thing. Then you don't end up with the issues with the hair or the weight gain. And then another big issue that PCOS causes is pelvic pain, because when your ovaries are full of those cysts, it causes a lot of congestion and pain and cramping. So being on the pill prevents all that from happening. So if you're on the pill, you're going to be one of those people that wants to stay on it unless they're pretty much trying to conceive, because your benefit from being on the pill is going to way outweigh any risk that you have from being on the pill. The pill's going to harness the ovaries and make them do the right thing and keep all of those complications from occurring. The big question that we get whenever I tell somebody that they have PCOS is, will I be able to conceive? And the answer is absolutely. You might need a little help, so while the natural fertility starts to decline at age 28, you're probably not going to want to be one of those people that waits till they're 35 to start trying. And it seems like people are most fertile right when they come off the pill, because once they've gotten in a pattern of having their ovaries do the correct thing, when they come off of it, sometimes the ovaries will continue to do the right thing, and it's easier for them to get pregnant. As this period starts spacing after it's been a while, and if you haven't gotten pregnant, you'll notice your period starts spacing apart again. And that's when you need to come see us to get some medication help or see a fertility specialist. But usually it doesn't take too much extra effort for us to get you pregnant. So I hope that's inspired you if you're someone who has irregular periods to come in and get checked out. And so we'll just plan on seeing you at the office.